Hi, I'm Debbie from Medstrom. I'm a member of the clinical team. We understand at the moment it's very difficult for us to gain access to help deliver training in the wards. We also understand that it's incredibly busy on the wards. So what we've tried to put together for you is a quick, bite-sized 5 points in less than 5 minutes to help you. The purpose of prone position is to improve lung perfusion and oxygenation. In critically ill patients with respiratory compromise, it has been shown for the short term that prone position improves both oxygenation and lung compliance. It's very important that when looking at proning a patient that local procedure and protocol is adhered to. The decision whether or not to put a patient in the prone position, what degree of reverse Trendelenburg to put the bed in, and whether or not the patient may be able to be repositioned once they're in the prone position will always be a multidisciplinary team decision. When a patient is in the prone position, the most common complication is pressure injuries. This is because once in the prone position, the patient will not be repositioned as frequently and sometimes as little as once in 16 hours. The other complication may be facial edema. So it's very important when considering putting a patient into the prone position to mitigate any of these complications. Beds such as this one that can offer a lateral tilt may assist with small micro movements in order that different parts of the body may become load bearing. Should be noted that with hemodynamically unstable patients, this decision will be led by the multidisciplinary team, but the benefit of a tilt function will be that the movement will be hands off, so I won't have to physically touch the patient to do so. The benefit for the caregiver of using a lateral tilt can be shown by this demonstration. If I'm going to reposition my patient, you can see by the angle of my back that I'm going to be using my back and my arms to complete this maneuver. If I put the patient into a tilt towards me, you can see that instantly my back is in a much more aligned position and the tilt will make it easier to move the patient towards me. Therapies such as fluid immersion and air fluidization may be particularly useful when we have complex patients who are unable to be repositioned for a period of time. Because the most common complication is pressure ulcers, a demonstration like this can explain what the difference is of fluid immersion and air fluidization to tissues. If we take this as a demonstration of a tissue or a cell, when cells are loaded heavily for a short period of time or loaded for a prolonged period of time, the cell can become damaged. And here this one has got a flat bottom. If a cell becomes damaged, all the cells surrounding this cell now has to take additional load. Where a cell is placed in a fluid environment, you can see that the structure of the cell is completely unflattened. It's kept in its natural position. This means that the cell is less likely to become damaged. By using a fluid immersion or air fluidized system, patients who are unable to be repositioned for a period of time can get better outcomes. So with patients who are respiratory compromised, we've talked about proning patients. We've talked about how pressure ulcers are the most common complication of proning patients. We've spoken about the use of lateral tilt to assist patients who may be hemodynamically unstable and physically unable to be repositioned for a prolonged period of time. We've spoken about how lateral tilt helps the caregivers and about air fluidized and fluid immersion therapies with this group of patients.